Cocaine and its side effects. Cocaine is a central nervous system stimulant, which is a powerfully addictive drug. Although healthcare providers use it for medical purposes, such as anesthesia for some surgeries, recreational cocaine is illegal and can cause euphoric effects. Some short-term physiological effects of cocaine can include constricted blood vessels, dilated pupils, and increased body temperature, heart rate, and blood pressure. Large amounts of cocaine, however, may intensify the user's high, but can also lead to bizarre, erratic, and violent behavior. Some cocaine users report feelings of restlessness, irritability, panic, anxiety, and paranoia. And users may also experience tremors, vertigo, and muscle twitches. Some of the science behind addiction of crack cocaine. So what makes it addictive? Crack cocaine blocks presynaptic reuptake of dopamine, allowing it to build up in the synapses in the brain. The resulting increase in dopamine activity and stimulation of dopamine receptors is associated with a rewarding, pleasurable euphoria. So what can go into it? So cocaine can be mixed with many things. Just to start, a lot of drug users mix alcohol with the drug. But some additives that we commonly see in that is used in combination with crack cocaine is laxatives, caffeine, boric acid, local anesthetics like procaine, creatine, and opioids like fentanyl. And what can make it dangerous? So crack cocaine's cardiovascular effects can result in cardiac arrhythmia, which is an irregular heartbeat, cardiomyopathy, heart attack, and stroke. Crack cocaine can lead to substance-induced formication, where the user thinks bugs are crawling under the skin. And this can also lead to other behaviors, such as scratching and biting the skin due to these effects. So how long does it take to get addicted? So typically after the first use, it will make people want to use it again, which can lead to addiction. And the regular use of crack cocaine can obviously lead to addiction as well. So how long does it take for withdrawal symptoms to stop? So studies show that this resolves after about 7 to 10 days without using the drug. And to the left right here, we can see some of the effects of crack cocaine on different parts of the body that I will go into in a bit. So some statistics of cocaine use, according to the United States population in 2021. So we can see here that the population 12 years and older cocaine use in the US in 2021 is about 1.7%, which is 4.8 million individuals that have reported cocaine use. Overdose fatality involving cocaine in 2021, it was approximately 24,486 individuals. And the reported cocaine use disorder, which we can also which we know it as addiction in 2021, is about 1.4 million people in the past 12 months surrounding 2021. So it's important to get cocaine addiction rehabilitation as soon as possible, not only because of the psychological effects, but because of the long-term physical effects that we can see that affect the body in many different ways. So this quote actually came from the American Addiction Centers. So just some of the long-term effects on the heart and the cardiovascular system is the damage that it can cause, and it can lead to high energy, anxiety, stress, and paranoia. And some of the cardiovascular system effects that cocaine has, long-term or even short-term, is blood clots, which can lead to heart attack, and about 25% of deaths among individuals 18 to 45 who have used or abused cocaine. There is a 25% of statistic of a heart attack being the leading death among these individuals. Other than that, we can also see that arrhythmia, which is irregular heartbeat, is also caused by the use of this drug, and the death of heart muscle from the from the lack of oxygen related to poor blood flow due to the drug can also lead to angina, which is chest pain from tightening of the vessels. So the long-term effects on the nose, mouth, and sinuses is that eventually the drug from snorting it as a way to administer the drug can eventually break down the tissues of the nose, and it can become damaged and eventually die. There is a plastic surgery that is able to fix this because many times people that use cocaine long term, their nose will actually eat away and it will close up, which can cause breathing difficulties. So in the mouth, a similar process happens compared to the nose. So platelal perforations are caused from long-term abuse. And the long-term effects on the respiratory system, so snorting cocaine can cause the mucous membrane damage through the sinus cavity, which can cause serious respiratory problems. So the blood vessels in the capillaries that carry oxygen to the rest of the body can eventually be destroyed, causing chronic cough and infections like pneumonia and tuberculosis and other effects like asthma and pulmonary issues. We can also see that cough, wheezing sounds, pain, and increased presence of white blood cells and raised body temperatures are an effect of long-term cocaine use. And these are just some references. And yeah, thank you for listening to my presentation on the effects that cocaine has on the body.